Hi, I'm Dr. Karen Leong. I'm a board-certified plastic surgeon practicing out of Newport Beach, California. So when a woman walks into my office for a vaginal rejuvenation or a labiaplasty consultation, one of the most common things I hear is, I didn't even know this was an option, or I didn't know we could do something about it. So then we go into a discussion about what makes a good candidate for vaginal rejuvenation. Vaginal rejuvenation, at least in my hands, is comprised of a couple different options. The most common being labiaplasty, or treatment of excess tissue of the inner lips of the vagina and the clitoral hood. The other parts that can be treated at that time are the labia majora, or the outer lips, which tend to get deflated or lose elasticity and volume with age and childbirth. The third thing that women come in to me for is tightening of the vaginal canal. This is a vaginoplasty or a perineoplasty, and this is muscle tightening. And I liken this to correcting the muscles that separate during childbirth in the abdomen. It's the same with the vagina. You imagine you're pushing an enormous head through this tight canal, maybe more than once, and even after everything recovers, it's never quite the same. So women come to me for these types of procedures. Let's start with a little bit of an anatomy lesson. If you look at my diagram over here, this is if we're looking straight at the vagina. When I do my consultations, I always say, it's best if we look at this together. And you'd be surprised by how few women actually look at their vaginas with a mirror. If you're a woman or if you're a partner, I highly encourage you just take a look. So when I do my consultation, we look in the mirror and I say, first of all, these are the outer lips, and then these are the inner lips. Like I said, my most common procedure is a labiaplasty. So the majority of these women are coming in with excess tissue of the inner lips of the vulva. In conjunction with this is the clitoral hood, or the hood or prepuce that covers the clitoris itself. Oftentimes that is also hypertrophic, or there's extra tissue. So when I'm doing a correction for the cosmesis, or the appearance of the labia minora, I'm treating both of them at the same time. People who come to me for labiaplasty consultation often complain about dryness, irritation, troubles during penetrating sex, issues with self-consciousness or loss of self-esteem because of the appearance and feeling of these inner lips. And very commonly in Southern California, they say, I can't wear my Lululemons, I can't wear my teeny itty bitty bikini bottoms, I feel like there's always a camel toe, or that I need to shift the lips one side or the other, and I just don't feel good about it. And then the next thing they said is, I didn't know there was an option, I didn't know I could do anything about it. And then we transition into talking about what we can do about it. At the end of the consultation, having taken a look at all the different aspects that contribute to the concerns in the patient's mind, these are the aspects that contribute to whether or not a woman is a good candidate for vaginal rejuvenation.